Hello friends, welcome back to NRI Samay Saturday's edition live show today. We have an incredible guest, Dr. Ravi Hiremagalore, Senior Consultant and Pediatric Dermatologist at Manipal, Bangalore Hospital, live with us from Bangalore. So generally pediatric dermatologists, they treat a variety of pediatric skin conditions using the latest available treatment methods, and they treat children from birth to through adolescence. So Dr. Ravi is one of the very few rare doctors in Bangalore who is right now practicing pediatric dermatology exclusively. Dr. Ravi for sure can help us understand better, as he worked on both sides of the world, worked earlier in Michigan and Chicago hospitals, and from there on he has been working in Bangalore. So Dr. Ravi today would help us all understand a little bit about the new age disorder called eczema as well, that has become a nightmare for little kids. So Dr. Ravi, welcome to NRI Samay live show. Sir, good to have you on our show today.
Yeah, hi. Likewise.
Thank you, sir. Thank you. So friends, first of all, I would like to reiterate the fact that any information provided on this show is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship here. So you should not use this information on the show to diagnose or treat any health problems or diseases without consulting your qualified healthcare provider. So NRI Samay Radio advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or any questions you may have regarding to any medical condition. So the recommendations in the show is that listeners' discretion, and NRI Samay or the doctor is not responsible for any of it. For all of you, this show is mainly intended to create general awareness about eczema. So that's all about it in the show today. And thank you for understanding, friends. So Dr. Ravi, let's start off with the show right away and to talk about eczema first. So tell us, is this eczema disease or a disorder, sir?
A disease and a disorder is something, I mean, in a layman's term, I think it means the same. I would put it like a skin condition. It's basically an inflammatory condition of the skin, and it's a form of dry skin, to put it very, very simply. And it's a recurring condition. It's a chronic relapsing condition, particularly on the skin. And it affects mainly the infants and children. And it begins in infancy and goes on sometimes even up till adolescence. It has a lot of impact on the child and also on the family.
Very true. So, sir, how does a parent who has a little kid realize or detect that a kid has eczema in the first place? It could be any other skin disease, right? So what are the symptoms of this disease, disorder? And let me not call it disease, call it a disorder.
Condition. Yeah, I would put it as a skin condition. That would be the appropriate terminology to use. Basically, it's in the very, very infantile phase, it's very difficult to make a diagnosis. But there are some features which gives us the clue. As I said, it's a chronic relapsing condition. So that means you have rashes appearing anywhere on the body, and it recurs. So it waxes and wanes. So there could be periods of no rash at all, and there could be periods of having rashes. And a very important symptom is itching. So if it's an itchy rash which is waxing and waning over, say, 3-4 months, you're pretty much certain that you're dealing with this condition.
Right.
So I would say to the parents that, if they see some, it's very difficult to make a diagnosis in very early infancy. Like I do get kids who are less than 1 month of age with features of this condition, but it becomes hard for us to make a diagnosis. But there are certain criteria which we use again, as I said, the criteria, if you go strictly by the book, it's difficult to make a diagnosis at this age of 1 month or 2 months. So, we generally give a general advice to the parents so that they're aware of something like eczema, and they know that they can expect something going on for some more time.
Oh, okay. And sir, is this a new age disorder? I've never heard of this when I was in childhood. So, what is this? This eczema is something that you're hearing very new in this new age.
They do call it this. It's a condition of urbanization, and it's mainly seen in the cities, and it's not so common in the villages. Because where I practice, I do go to a government hospital also, and I don't see many of those cases there. There is a hypothesis which they thought was the cause, like it's called hygiene hypothesis. So you were kind of with the urbanization and the awareness and the education, we kind of overdo ourselves in keeping ourselves clean and hygienic. So that makes us susceptible, or our system susceptible for skin conditions and similar other conditions. But I'm not too sure how, this thing has been debated over the decades. It's not a very, very new age condition. It has been there for quite some time. Probably we are becoming aware of it now, and people do attach a lot of importance to the skin. So I guess it's probably the awareness coming in which is making it appear new rather than it being actually new.
Oh, okay. So do you think there is no hygiene or anything attached to this problems that it just...
I didn't mean to tell that. What I meant is actually we overdo things. We wash our hands. We kind of keep ourselves very clean, and we select the places where we eat, and so in such a circumstance, the body's immune system is not kind of tuned to accept the external influences of the environment. So that becomes a predisposing factor to develop these kind of conditions. We call them atopic conditions, and atopic dermatitis or eczema is one of them.
Oh, okay. But also,
but then this hypothesis has been questioned. People do question this, so whether it's really that or not.
Oh, okay. You touched upon a little bit on what causes this disorder. Can you elaborate a little bit on what could be the realistic reasons for why skin disorder or skin condition would happen, sir?
That's a really tough question to answer. I wish we could answer that question with full confidence. Anyway, it's supposed to be a multifactorial etiology, just like something like diabetes and hypertension, where there are several causes for the particular condition. Now, one of the causes is genetic. So it doesn't mean that there should be somebody in your family to have eczema. But it could be also in the form of asthma, allergic rhinitis, hay fever, chronic urticarias. So these are a very similar group of conditions. So if somebody has this, then you are predisposed to developing eczema. Now, I might be using the word atopic dermatitis and eczema. I would use them interchangeably. So I would request all the listeners not to get confused between the terminologies. Okay. Eczema is a very broad category of conditions. And atopic dermatitis is one form of eczema.
Oh, okay.
When we say eczema, we invariably mean atopic dermatitis.
Okay.
So as I said, coming back to the etiology, genetic factors play a role. And the second thing is the body's immune system. So as I said, there is the immune system, there's a complex network. In fact, scientists are still working on what exactly are the pathomechanisms for which results in this particular condition. And there's an interplay between the environment, the genes, and I would say the immune system. So environment does play a role in the sense that these conditions are common in winters where the weather gets very dry when the humidity levels go down. And they're common, there could be some environmental triggers also for eczema. For example, foodborne or airborne triggers could be there. So they do play a role in worsening eczema, but the cause of eczema per se is not really understood in the right way. So, but they do believe that it's a complex interrelationship or interplay between the genes, the immune system, and the environment. Am I too fast, or I'm okay?
Perfect, sir. Perfect. A lot of actually writing back saying that they're able to hear it well, and everything is perfect.
Okay.
So let's take it this way. Is this something parents need to be worried about seriously, or they can play it subtly? What do you think, sir?
Well, I guess as a parent, everybody takes anything seriously on a child, and they're right in taking this condition also quite seriously. It doesn't mean that it's going to hamper the general health conditions, growth and development in the child. But I think what they need to understand is that this is a relapsing condition, and this is going to be there for quite some years, whether we like it or not, and learn to do away with the myths which are created by media as well as the family. So in that sense, I think they should take it quite seriously. Like here in India, there's a lot of myths about skin conditions in general, and people are free to choose their doctors out here. So generally what happens, we call it as doctor shopping. So generally what happens is this is very, very common with this condition, and hence this adds to frustration. So, and each doctor treats based on their learning and experience, both. So, in that sense, I would say that they should understand the problem and try to do things which helps the child rather than just listening to hearsay evidence.
Okay.
I hope that answered the question.
Pretty much, definitely. And we have Jaya writing to us on nrssamay.com. Her question is, sir, I have a query regarding my 9-year-old daughter. She has palms all the time and finds it hard to write or press her hands to her friends. She feels miserable for having such palms. I try to suggest her to carry a hand towel always and keep an handkerchief while writing, such that the paper does not become wet. Have tried several remedies, but no luck. Several visits to our family doctor hasn't helped too. Would like to ask Ravi his opinion, please.
Well, as I think I would not be hesitant in answering this question, because first of all, it's not related to the topic of eczema. So I would not want to deviate from this. But yes, as a general note, I think you should really go back to your doctor and tell them that maybe this is what you have done and it's not helping you. So you will have to probably listen. If he's probably even suggest that he could refer you to a dermatologist. That's the very least I can advise you on the phone like this. But I wouldn't be able to recommend anything on the phone.
Oh, okay.
And it's not related to eczema, so I would prefer if the questions are really related to eczema and care of dry skin, so that everybody kind of gets the benefit of the show.
Absolutely. And also, I wish to reiterate to friends that this show is not to replace the services of a physician, or does it constitute
exactly
a relationship. So, not use any of this information on the show to diagnose or treat or any of these health problems or diseases without consulting your qualified health care provider, please. This is to bring in a general awareness about eczema, dry skin, or atopic dermatitis phenomenon in little kids. So please keep focused on these questions. We request all the listeners to be focused on these questions. So coming back to our problem here, when we are talking of eczema is not a skin disorder that sometimes might not catch up with birth, or it's genetically showing up. It could even catch up after 2 to 3 years of birth, or even 4 years of birth. So why would it generally show up after 2 to 3 years after birth, sir?
Well, as I said, it's not completely genetic, all genetic disorders need not present at birth. There could be some things which could present later in life also. So, and particularly so when you have multiple factors in the causation, it may not show up right after birth. So, as I said, the immune system plays a role, the environment plays a role. So there could be these two factors also playing a role, and not just the genetic factor. So that is the main key thing which makes them present. But why in some it presents early, why in others, I don't think really we have an answer to that. This is this is probably the only explanation, that the environmental factors and the immune system factors have not yet kicked in to cause the problem.
Okay.
Although you are genetically predisposed.
Oh, okay. This could be a lifelong problem, sir, or it just will?
Not really. Most of the childhood eczemas do clear out by puberty. In fact, many of them do clear out by the time they hit the school. That's around 5 or 6 years of age. But then there's something called as an atopic march. So you start with eczema and you develop some other related condition like asthma or allergic rhinitis later on, or vice versa. So that can happen, although eczema per se is not like a lifelong condition.
Oh, okay. So you're saying that there's a connection between eczema, asthma, any other connections with hay fevers and also allergies?
Yes. Hay fever, allergies, seasonal allergies, and allergic rhinitis, that's what I said. And allergic conjunctivitis, that's the other condition which do present with, reddening of the eyes and watering of the eyes. They're all related conditions, and if a child has one, he or she is predisposed to have the other. And it is also quite possible that you start with one and you end up with the other. And invariably, a lot of people have this myth here at this point. I would like to mention that treating one, they think that treating one or suppressing one leads to the other. That is not true. So they end up not treating or under-treating one of these conditions, which is definitely not true. So I would say that it's actually the process of atopic march going on, and not that you suppressed one condition and that led to the others.
Oh, okay. So we have Mohan from US. He's asking, My daughter is 22 months old. She was diagnosed eczema when she was 3 months old. She was born in United Kingdom, UK. She is advised paraffin wax-based ointment and paraffin-based liquid soap. She is now in India and doing a lot better. She seems to have improved. Does Indian environment cure eczema?
No.
Oh.
No. I wish it could. Well, no, that's not really the thing. And I get a lot of questions based on this. I see a ton of eczema a day over here in Bangalore, and it's not like we are safe from eczema. It is quite possible that she is slowly outgrowing the problem, which she's around 22 months, almost 2 years. So it's quite possible that she's outgrowing the problem, and that could be the reason. But then I'm sure there could be episodes which are waxing and waning even now. It's not that she's gotten rid of the problem completely. So that is one thing which goes to tell you that it's not only the environment. And then I also get these questions, will it help if we move from one place to the other? And parents do take some of these drastic decisions based on, and in fact, when it comes to the child, we go to any extent to take the decisions. So in such a scenario, I do tell parents that it's purely a personal choice, and your career and your profession and your work is also equally important as much as it is, as much as your child's skin condition. So because this is not going to go away with just you moving from one place to the other. So if you come down on your profession and you do all this for your child and it still comes and goes, it adds to frustration.
Huh.
So that's the reason why I tell that environment is not alone important. It is an important factor, but it is not the only factor. It is also the genetic background, the predisposition, and the immune system. And I've been telling that again and again, and I keep telling that again and again to all the patients. So I hope that answers his question. So answer is no. It's not because of India.
Yeah. So we have Sindhu here asking a question. Sir, I've been I have my kid having eczema very early in the age. And then we moved from San Jose to Chicago, and the there are extremely severe cold conditions.
Yeah.
And my kid caught up with pneumonia, so that in turn turned into an asthma because she never had asthma. So do you think moving from a place like San Jose and then going to another place like Chicago would have flared up this condition?
Yeah, it could be because dryness, I was in Chicago for 3 years, so it's extremely dry out there. So that brings in a lot of pollens, and that could have been a trigger factor, but that's not the only factor again. So it could probably have happened even otherwise.
Oh.
If you could develop pneumonia anywhere in the world, even in Bangalore, anywhere in the world, you could develop a pneumonia. It's basically a bacterial infection, and post pneumonia, you could have some kind of a bronchitis or whatever, like a reactive airway disease they call it, and that could be the process which is just going on. And coincidentally, it happened that they moved to Chicago, and it could have been a coincidence, or it could also be explained by the presence of pollens. And in each place, the pollens can be different. So, and in each weather, the pollen can be different. So you have different kind of pollens in summer and different kind of pollens in winter, and these factors do play a role to some extent, but not completely.
Okay, so we have Raghu Nandagiri, sir. He's asking, I've been in Michigan and it was very dry and there was little moisture. In India, do we have better moisture conditions in India, and that's the reason we have lesser kids having eczema?
No, it's not that we have less eczema over here. It was just less detected. The awareness has become so much now. If you come and sit with me in my clinic, you would know that eczema is no less. But again, I am a pediatric dermatologist, so I see a lot of these cases. But the prevalence of eczema is on a rise even in India. It's not that India is safe from eczema. Yes, coming to the first part of the question about the humidity in the environment, yes, if you go to places like Chennai, Mumbai, Kerala, where the humidity is quite high, the chances of having eczema are less. But my colleagues in these places do see a lot of eczemas. Bangalore is a very, very dry place. It's an extremely dry place. It's almost like, it may not be as bad as Chicago, but it is quite dry in winters. And we are facing a lot of cases of eczema out here. We do not have a sea influence out here. So the humidity levels are very low in winters. So that worsens, and that makes the pollens come into the air, and it triggers the eczema. So there are places where which are quite humid, and there are places which are quite dry, even in India. So it's not like they are safe, and it's not just because they are humid. In fact, it has a counterproductivity, the opposite effect also. Like I have seen patients who are from these places, and their eczema worsens when they go there, and the only explanation is sweat. So in a humid place, you sweat a lot, and sweat triggers itching and worsens eczema. So it could, in fact, be the other way around also. So it's not like humidity alone helps you in the eczema, but in fact, it can worsen your eczema because of sweating.
Oh, okay. So we have Sindhu again. She's asking that when my kid is having a little bit of wheezing or a little bit of cold, we tend to give her steam of hot air so that she can breathe. Having this, what is this called? Eucalyptus oil. And
okay.
Does that? She's already having eczema. Does that steam of eucalyptus oil really flare up the eczema? Should we avoid that?
I don't believe so, that it should flare up, but I would say it's too. I mean, how old is the child?
She's 6 years old.
Oh, 6 years should be okay. Because if it's a very small child, I would rather just do steam inhalation than with using any of these eucalyptus oil and, the other traditional stuff. Just steam inhalation should be fine. Oh. Unless it's been advised by the doctors that they should put in some eucalyptus oil and take the steam inhalation. Has it been told that way?
I have no back-to-back answer from that yet.
Oh, okay. Okay, that's fine. No, what I would tell is, I think the answer to that question is probably not. I don't think it would worsen because it's just, sometimes, it might worsen the eczema and the asthma, if at all, because of the droplets and the particulate matter which goes into the air. But otherwise, I don't think it should worsen the eczema.
Oh, okay. Good. So let's come to this. What are the practical ways to treat eczema?
Yeah. The most important is, I think, understanding the problem. That goes without saying. I mean, it's about the same principle in any walks of life. You understand the problem is solved 50%. Now, this is I'm quite emphasizing on that fact of understanding, because most parents don't realize that this is a relapsing condition. They just want complete cure. I understand that thing because, I am a parent and I have a daughter who's 6 years old and she's having allergic rhinitis. She keeps getting coughs and colds, and I know how frustrating it can get. But then we need to deal with this fact that it's going to be there for some time. So that's the first thing. Now, coming to the second thing, the next most important is moisturizing. And tons and tons of moisturizers which are available in the market. I do not want to name any brands because I don't take sides of any brands. But in general, what I would recommend is something in the solid form would be better than in the liquid form. So I would say creams and ointments are superior to lotions and gels. So if there's something which you are pumping out of a bottle and you have a child with very dry skin, then that's not enough. But on the contrary, you need something which you scoop from a jar or you squeeze from a tube. So that would be a good moisturizer. And then it should not have fragrance in it. So try to avoid products which have fragrance in them, because fragrance, again, irritates the skin and worsens the eczema. So these are, and there are tons of them. So I keep getting these questions. Somebody's friend told them that this was the world's best moisturizer. Somebody else told them they hated this moisturizer. This is their individual experiences. So what I tell parents is the answer is you see it on your own child.
Oh, okay.
So which moisturizer is good for your own child? And stick to that, not just keep buying things out of the shelf or reading somewhere or somebody gifted them from somewhere and it's not needed. So what you need to do is it should be easily available. It should be thick and in consistency and it should not have fragrance, and you should do it repeatedly, consistently. So very, very religiously.
Oh.
So that is very, very important in the management of eczema. So this is the second important, moisturizing. That's very, very important. Then coming to the actual management of eczema, there are several things. We give the creams to apply. We do a lot of steroid-based creams, basically. And we have come up with non-steroidals, although they are not FDA approved under 2 years of age. But they do help quite a number of cases. And this is purely, I don't want to deal with this aspect because the decision has to be taken by the physician who's treating the child. The other thing is trigger factors. So identification and elimination of trigger factors. This is where the parents play a very, very significant role. So what I tell parents, it depends again on the age group of the child you're dealing with. Now say you have an infant who is in the weaning period, 6 to 18 months of age. That's a very, very critical period where you are introducing newer and newer fruit products. So food allergies can happen in a child with moderate to severe eczema. And so identifying that particular food, it does not mean again that the food is causing eczema. It is just that the child is having eczema and the child is also having food allergies, which is kind of adding fuel to the fire. So identification of this is quite important. So maintaining a food diary, I explained to them how they can maintain a food diary and not just go by those tests. There are a number of cases who come with a whole bunch of tests which have been done, and then they're confused. It shows positive results. They stop giving the foods which they had initially given, and that adds to more frustration because the child is not putting on weight. So this factor is very, very important to deal with, particularly when you are encountering a child who is in the age group of 6 to 18 months. Whereas an older child, say who's a school-going child, airborne factors become very, very significant. And two important airborne factors could be pollens and dust mites. Dust mites are quite prevalent even in India, and I'm sure it's much more in the US, especially where there are carpeted homes. So I generally tell parents to take off the carpets if possible, and try to remove all these soft toys and and these fleece blankets, woolen clothes, where the dust mites can accumulate and cause more worsening of eczema. So identification of triggers. So that's the fourth important aspect of management. So it's first understanding, 2, moisturizing, 3, the creams which the doctors prescribe, and 4, the identification of trigger factors.
Oh, okay. Sir, are there any tests that can detect these causes of flare-up of eczema?
Yes, there are. As I was telling you when I was talking about the trigger factors. We do have different kind of tests. We do prick tests, and some of them do patch testing. Some of them do the blood tests. So all of these are helpful, but they are not the gold standard.
Oh, okay. And
yeah.
Also, you mentioned about steroids. What precautions? Because steroids are being used, and if it worsens a little bit. So, what precautions are required for this, sir?
Yeah. So, go by the doctor's advice. That's very, very important. Do not hesitate to ask the doctor whether this steroid cream can be used on certain very sensitive areas like the face and the genital area. So, so you need to most of the doctors do explain and tell them that these are the creams which have to be avoided on these areas. So, if they haven't, so you can ask your doctor, discuss with the doctor. It's very important not to have phobia. Oh. And steroid phobia is a very, very common thing, particularly in parents who have children with eczema. I always tell Google is my worst enemy. I know it's a boon, but it can be a bane also. So, but in the precautions, coming to your question, I would say that if you're not getting the benefit in, say, 2 weeks of continuous application on a given area, my words are very, very important. It's on a given particular area. If the response is not showing up in 2 weeks' time, I think you should revert back to your doctor and find out why it's happening. And there are certain creams which are safely used even under 3 months of age, and so probably try not to go by the over-the-counter stuff. Try to discuss with your pediatrician in the very least. I'm sure they will be able to treat at least the mild to moderate eczemas, if not the severe ones.
Great.
So, and always be cautious about how much you are using. Do not keep it at a place where it is available. Always the medical shelf should be higher up in the house. The cabinet should be higher up where you keep all your medicines. So it's not. It may be just a cream, but it's still a medicine. So it should not be used unsupervised by a child. That's very, very important. And it's not like a moisturizer also. So it shouldn't be kept just lying down on the the furniture, and where the child can always use it on his own. So these are some of the precautions.
Right.
Talk to your doctor. Again, that would probably be the best solution.
Excellent, sir. And also, you mentioned maintaining a diary about this eczema would really. Mm-hmm. So I've recently come across Bayer has released an app, especially for iPhone and Android, that maintains a perfect diary of eczema. It's a pretty comprehensive app. Any ideas on that front, sir?
Oh no, actually no. I'm sorry to say that I'm not very tech savvy, but then it will be interesting. To note that it'd be a good app to incorporate. But I do have. It's a very, very simple way to maintain a diary. You don't need a big diary for it. All you need to do is put a date and take a book, maintain a book, put a date, and put. You write there what you gave to your child, and then you kind of see what happened on the skin on the same day. So that is a very, very simple way. You don't need to have an application like that. But yes, if there is an application, it always helps. So if you are kind of attending a party or something and the child accidentally ate some nuts or something like that, and half an hour later had a rash, so immediately you can kind of just jot it down on your iPhone rather than searching for a book. You can't carry a big book or a diary everywhere you go, right? So that way it might help. But yeah, I think any kind of diary. It doesn't have to be a full-fledged diary with the regular way.
Right, sir. Yeah, very true. And also, sir, even before it's already past 40 minutes, I'm really appreciative of your time here. So there's a question that's coming in. They're asking, sometimes when my kid is having a lot of itchy sensation, I'm giving coconut oil or almond oil or olive oil, and sometimes if she's scratching her face, I'm putting in chandan. Sir, is this all the right methods we could use as a homemade remedies? What do you think about it?
Chandan, no.
Okay.
Because it might be a soothing agent for the immediate relief, but then over a period of time, the skin can get dry. So I wouldn't recommend chandan. Sometimes people ask me about these calamine lotions. Again, that also I would tend not to use because, again, over a period it makes the skin dry. The best thing to do at that time is to moisturize the child. So coconut oil, any of the oils are fine, or your regular moisturizer, whichever you've been using. And if it's an older child, I tell parents to educate the child to tell them when he or she feels like scratching. So instead of the child kind of digging with his fingers, if you can just scratch with your palm, that really helps.
Oh, okay.
And of course, you could ask your doctor to prescribe some oral medicines if at all it gets very, very itchy and it disturbs sleep.
Oh, okay, great. Sir, for one last thing again, I'm getting in so many here, but I'll have to stop it at some point in time. Does taking a bath every day dries out the skin? Many say that this is one of the causes that flares up and aggravates the situation. What's the truth in this?
Yeah. Now, coming to this concept of having a bath, the concept of bath in the U.S. is very different from India. So, if I'm answering if this person who is asking a question is in the U.S., bath is bath in the bathtub and not a shower. So, taking a shower is fine, but putting the child in a bathtub every day would definitely worsen the eczema because it makes the skin more dry. And no bubble baths and no sitting in the bathtub for more than 10 minutes.
Oh, okay.
So, but otherwise you can have a shower. You can that cleanses off the bacteria present on the skin, which in fact worsens eczema and makes your treatment unresponsive. So we do advise once a day cleansing, I would put it as, either in the form of a shower or in the form of a bath. But the Indian form of bath is very different. So with Indians who ask me this question, I say once a day bath is fine.
Oh, okay, great. So we have Mohan from United Kingdom asking once again, my 22-month-old daughter has milk protein allergy, but is fine with butter and ghee. She weighs less than the same age. Is this eczema related?
Yes, it is eczema related. The weight gain will happen. I mean, they usually outgrow these milk protein allergies too over a period of time. You may have to discuss. He may have to discuss this with the pediatrician to have the hypoallergenic formulas or the substitutes. They'll advise you on that. But then, yes, poor weight gain per se is not directly related to eczema, but then I do see very severe cases who have these kind of food allergies where the food has to be restricted. That's the time where the weight gain is a little slow. So, but if it is it still wouldn't be below the 5th percentile. So if it's something really, really low, they should consult the pediatrician.
Excellent. And final question, what kind of clothing should my kid wear to school? She's 6 years.
Great. Cotton.
Cotton.
So why I said cotton is because in very cold climates, you tend to put on woolen sweaters. So 3 layers or 2 layers of cotton. Okay, so all the layers being cotton. And that helps in absorbing the sweat, and which in turn kind of helps the eczema.
Oh, great.
Prevents from flaring up.
Excellent, sir. Dr. Ravi, it's a great pleasure and honor to talk to you on our show today. And thank you very much again for giving all the insights about eczema, the symptoms, the causes, the remedies. So really appreciate your time today.
You're welcome. Thank you. I really enjoyed it.
Thank you, sir. Thanks a bunch for coming on the show. So, friends, that was Dr. Ravi Hiremagalore, Senior Consultant and Pediatric Dermatologist at Manipal Hospital, Bangalore. So pediatric dermatologist, as Dr. Ravi was saying, treats variety of pediatric skin conditions using the latest available treatment methods, and they treat children from birth to adolescence. Dr. Ravi is one of the very few doctors in Bangalore who's right now practicing pediatric dermatology exclusively. And if you're in Bangalore and you have any of these conditions, please do visit Dr. Ravi Hiremagalore, and he can surely help understand better on this eczema conditions. So friends, thank you very much for tuning in today and then listening to our show. Come back again tomorrow for yet another incredible show. So we have M. Revati coming in tomorrow from reclaiming 3,000 acres of tsunami-affected land in Chennai to training 1,000 farmers on organic farming in Sundarban, leading to cultivation of 500 acres of land and to influencing the policy decisions to adopt organic farming in Sri Lanka and Indonesia. This teacher turned organic farming expert, M. Revati Garu, has done it all and is still continuing to cruise along. She's the one who believes organic farming not only solves the world hunger problem but also creates a lot of jobs. So listen to her live tomorrow at nrisamay.com, Sunday at 8 a.m. Pacific time, USA time, 11 a.m. Eastern USA time, 9:30 p.m. India time, 4 p.m. London time. So to friends in US, a very warm good morning and good afternoon to all our London friends, and good evening to friends in India and anyone else around the world. Have a wonderful weekend ahead. This is NRI Samay desk from NRI Samay desk. This is Srikanth signing off. Thank you, friends.